Please welcome to the stage Jeff Arnold, Alex Krinsky, Matt Pearson, and Chad Purcell.
All righty. Good afternoon, everybody. Thanks for staying here for the final panel of the day. Super excited to be here. The title of this panel is Committed Collaboration, Establishing Georgia as a Proving Ground for CMS's Health Tech Ecosystem. And if you happen to be here at lunch to hear Dr. Oz's keynote, his big theme was CMS is open for business. And I've known Dr. Oz for a long time. We started Sharecare together with our team over a decade ago. And I know a lot of the themes that he talked about today are really near and dear to his heart. But the theme that's most important to us is making Georgia a demonstration state for CMS and for us together to collaborate to improve the well-being of Georgia. And we've been able to put together an amazing panel today to talk about that collaboration. And so I thought maybe Alex and Chad and Matt, maybe we could start with you, Alex. Maybe you could just introduce yourself and maybe why you're excited to be here today.
Absolutely. Hi, everyone. Alex Krinsky. I lead strategic growth initiatives for Clear's healthcare business. Yes, the same Clear as the airport. I'll talk more about that. But I am so passionate about the simple fact that I am Alex, whether I'm boarding a flight or whether I'm going to see my provider. And I should be able to do things really easily with the snap of a selfie. And so we'll talk about how in the context of the CMS initiative and interoperability, there's a huge opportunity to remove friction for patients.
Perfect. Chad?
Hi, everyone. Chad Purcell. I am Chief Information Officer at the Georgia Department of Community Health. I have only been with the agency now for about 3.5 years, but I did spend 21 years in healthcare or higher ed. And the reason I'm passionate is because I just love data. It's something that I was promoting back in higher ed, and the reason I am sitting here is because of a lot of the interoperability and data cleanup and all those things that we're trying to do in healthcare. That's the reason I left higher ed. So,
awesome. Matt?
Afternoon. My name is Matt Pearson. I lead the healthcare business development at AWS. As far as what I'm excited about is first, I get to do a conference in my hometown, so very excited about that, being Emory grad and my son going to Georgia State. You talked about your passion for data. I'm so old that I'm a data scientist, but back when I studied it, they didn't actually call us data scientists. I think it was something like computer applications and behavioral sciences. And there was also no cloud. We were looking with punch cards. And so when I think about the acceleration and pace of technology in application to data, it's extremely exciting to see where we're at this stage. So.
Okay, great. Okay, so, when we talk, about open for business, what does that mean? And so I thought I could take a second and I could just walk down what are the 5 mandates that Dr. Oz and team have laid out. So the first mandate is how to kill the clipboard. And we all have that mental picture in our head of what that means. But we're going to spend some time talking to Alex about what Clear's vision is and some ideas we collectively have on to kill the clipboard. The second mandate is how to advance conversational AI. And so that's why we asked Matt from AWS to join us today and talk to us about all the wonderful things that Amazon is doing to bring ChatGPT-type cloud experiences to healthcare. The third mandate is how to ensure interoperability with data being at the core of that. And so we're fortunate that not only is that Chad's passion, but he knows a whole lot about it. And then the fourth is to drive community engagement, including workforce requirements. Dr. Oz mentioned that with Dr. Price on stage today. And then lastly is to prove equity at scale and close gaps, especially in rural health. Chad and I had an opportunity this morning to attend an event with Dr. Oz where we're at the 1-year anniversary of a tech-enabled care station that's a mile from here that 3,000 people have used in the last year for telemedicine and primary care use that has diverted 50% of those visits from the ER. That's just one example of great things that are happening. So those are the 5 mandates that we're all thinking about trying to solve for. The other thing that was discussed today on stage was as part of the big, beautiful bill was the $50 billion in rural health funding that's going to be coming over the next 5 years. So ideas are being solicited now. States will apply for those dollars, but it's going to be $10 billion a year for the next 5 years, which means there's going to be an enormous investment to try to fix rural health. And Georgia, in my thinking, is really in a great position to lead in that effort. And so when we talk about a demonstration state, what we're referring to is how can Georgia, through partnerships and collaboration and full transparency and leveraging data and everything that we'll talk about today, build a model for the rest of the country. But at the same time, we're mindful that this isn't just about mandates. At the end of the day, this is healthcare. So when we talk about killing the clipboard, you have to think about the grandmother in Macon who's tired of recalling and filling out 70 years worth of medical history every time she goes to the doctor. Or you have to think about the mom in Savannah, that's stuck on the phone today for 45 minutes trying to figure out if her son's doctor's in network. Or the Medicaid member in Albany who lost coverage because they missed a letter in the mail. So these are all real people stories all over the state of Georgia that we believe technology and collaboration and good data can help solve for. So with that, we're going to jump into some questions here. We're going to start with Alex from Clear. And Alex, is like we were talking earlier, obviously privacy is a huge deal when you're dealing with people's health, and trust matters a lot when we're trying to get adoption across an entire state. Can you tell us a little bit of what Clear's learned about trust and privacy working in airports and why you think that translates well to healthcare?
Yeah, absolutely. And it's exciting to be here. We have a long history in Georgia through our work with Delta Airlines and our presence in Atlanta Airport. And we've been operating in airports in very close partnership with the TSA and the Department of Homeland Security for 15 years now. And what we've found is it's absolutely critical to provide a seamless and secure experience. It needs to be convenient and valuable to the consumer. And so to use an airport example, we're actually rolling out e-gates. I went through one in LaGuardia this morning. It was awesome. I took a selfie, I walked through, I didn't talk to a person, and I put my bag through screening. It's now in Atlanta as well. I encourage everyone to find it on the way home. But it's these types of innovations that allow consumers to still feel like that challenging experience typically is really seamless and really secure. And when it comes to data, what we've done a good job of is being very transparent and communicative to our members about the fact that they are in control of their biometric data, they consent to share their biometric data. If they wanted to delete it, they could. And that type of control and transparency has really allowed our brand to instill a lot of trust in consumers. And so as we move into the healthcare space and as we work with patients that are looking to schedule appointments or enter a virtual care visit, it's really critical that, again, it's really simple and secure, and they know how their data is being used.
And you're already doing work around killing the clipboard before you even made your CMS pledge here in Georgia.
Absolutely. So Clear has been expanding beyond the airport for some time now through Clear One. Clear One is our secure identity platform. It's a digital identity that you can use on your phone, snap a selfie, and be verified. We work with a number of different types of partners. So, for example, at the Home Depot, if you rent equipment, you verify with Clear so they know who's renting that equipment. I've never done that because I am not handy and nobody would give me equipment, but people love it. In healthcare, we work with a lot of organizations, including Wellstar Health here in the Atlanta area, where we enable Wellstar patients to schedule appointments and check into clinics across the network with the snap of a selfie. And so we are so energized by the fact that CMS is talking about killing the clipboard, but we've actually been working on this for years with partners like Wellstar Health. And so when it comes to this clipboard problem, what are we really talking about? We're talking about the fact that traditional identity is very fragmented and antiquated, and it means that Georgians and all of us as patients need to fill out the same redundant forms over and over and over again. And that leads to higher costs, and it leads to really poor patient experience. And so with Clear, one of the core concepts is that we are a reusable identity platform. So we actually have over 1 million existing Clear members across Georgia. For those existing members, they can unlock an experience like scheduling an appointment with the snap of a selfie. And if you've never used Clear before, it just takes a one-time enrollment, you take a selfie, you upload an ID, and now you have that reusable identity. And so as we think about interoperability and the way to actually get rid of that paperwork, the idea that you can present yourself and rather have to reprove who you are, but just take a selfie to authenticate is really critical. I think the other piece worth mentioning here is that change is hard in the healthcare space at times, and we've invested a lot in making Clear available in the core infrastructure to meet patients and meet providers where they are. And so we work with EHRs like Epic and identity access management platforms like Okta and Ping so that patients are able to verify when they were already going to do so. So whether they're registering or creating a portal account or checking in. And so we make it very easy for them to leverage Clear and have it be, again, very seamless and secure in their existing experience.
So if we were to take Clear and use that as the front end to authenticate on a Sharecare, and 650,000 of those people are state of Georgia employees, and those people are also Clear members at the airport, they're already authenticated.
Correct. They would simply enter their phone number and take a selfie, just like all of us open our phones, and Clear would be able to authenticate them through that experience.
Yeah, that's awesome. Okay, Matt, back to your kind of data science days. No, I'm just kidding. We're all trying to eliminate fragmentation, right? The whole idea of collaboration is on behalf of the person, how do you connect the health plan, and how do you connect the provider, and how do you connect the employer? And can you talk a little bit about AWS's experience of bringing these groups together in scale? And then I have a follow-up question to you after that.
Yeah, let me start with a little bit of an analogy, because some people we were talking about earlier aren't familiar with AWS. And so what's interesting about that is, we talk about AWS as we're almost the music producers of the industry, right? We're not eccentric guitarists or lead singers. We're just the ones sitting behind them, helping everybody make great music. So that example you were just giving around the interoperability in the play there, it's like, well, you've got Clear that's on AWS, you have Sharecare on AWS, and you gave quite a bit of the examples. And so, what's the role that AWS plays here? We're everything underneath the hood, right, that makes all of this magic work. And I would even expand it a little bit further, right? Because if you think about things like clinical trials, right, clinical trials is very much all over the map, whether we're talking about drug manufacturing companies and connecting to patients through EHRs that might be eligible. Like, that's us behind the scenes trying to make a lot of that motion, that activity work. In thinking about a little bit about infrastructure, a couple things I wanted to at least highlight a little bit more is, here locally, CDC. So AWS was the first working with CDC to deliver BioSense. So BioSense was the first nationally available cloud-only solution back in 2009. And so that's kind of our starting points. One of the most recent investments, I don't know if you're aware, is Amazon announced, or AWS announced, that we're going to be investing $11 billion specifically to Georgia. And so when we think about the infrastructure, how do we support a lot of the interoperability or delivering better care? It's those types of investments. And so I think we're strategically placed to be able to support the ongoing innovation between everybody listed here, as well as the Kill the Clipboard initiative as well.
Yeah, exactly. And maybe for the audience, because I've enjoyed learning about it myself, is maybe you could talk a little bit about what is Bedrock and what is orchestration, and how does that assist us in our mission?
How much time do we have? Let me try to simplify it as best I can, because I think we're trying to democratize data, if you will, to the point where it's important to have builder tools for people that want to use their own data, they want to use their own data scientists, and they want to build from the ground up. So we've got those tools available to you, but not everybody wants to be in that space. And so we think about our customers from builder to buyer. What are the things that are best going to help them in their enterprise, in their specific use case? Because if you think about healthcare and oncology, cardiology, we have very specific use cases, and not every model is going to work for that use case. So you need options along that path. And so you mentioned Bedrock as an example. So Bedrock, it essentially opens up anybody that's interested in models. So you have a variety of them. I think last count it was 150 of those models. Some of those are AWS specific. You've got Anthropic, you've got Meta, you've got Hugging Face, everything you could possibly want. And so the reason that we brought this approach is, if you just think of the last 2 years in the horizon and how quickly innovation has moved specific to LLMs, once upon a time we were saying it was all about the biggest model that you possibly could, and then we saw that it was too expensive, it wasn't very accurate. And the next thing you know, we have more smaller, compact models and more specialized models, because at the end of the day, it's not about using the model, it's about the accuracy and the outcomes that you can deliver from that at a great cost. And so that's a little bit about our model and how we bring these forth. Bedrock happens to be the name because nobody wants to spend in infrastructure. They want to spend in delivering outcomes at an accelerated pace, and so that's where we come into play. The other piece I think you mentioned was guardrails. Guardrails is essentially, if you don't have guardrails on your model, then they're going to run wild, just like your kids. And so the guardrails essentially say, there are specific things that it should and should not be doing along the path. And so those guardrails help you simplify it so you don't have to be a programmer. You can essentially be the person that understands, hey, these are the things that our models should be showing our members or our patients. And so we're really, as I mentioned, just kind of democratizing a lot of these capabilities so you don't have to be a data scientist, so you don't have to be a programmer or a developer.
And as you think about, think just ChatGPT, it's almost 1 billion users. And you think about Claude and what AWS is using and others through Bedrock and all the other smaller models. When do you think from a safety standpoint, even with the best guardrails today in place, that we can start to expect kind of mass adoption of clinical LLMs?
Well, it depends on what you define mass adoption, right? Because even if you look at a lot of the models commercially available, the most often asked questions are around health and wellness. And so when we talk about when are they going to be used at scale? Well, I would say they're already being used at scale. Even before, the chief medical officer for every household was Google. And now it's shifted, and now everyone's started to use, commercially available ones. But I think what you're starting to see is a lot of that specialization, right? Do I want to ask specific questions about my cancer treatment or my comorbidities to a commercially available LLM? The answer is no, probably not, right? And so I think a lot of it has to do with the people as well, right? People being there's a certain pace that people allow technology innovation, right? Much like an organ transplant, it may be the best thing for our bodies, but eventually we will reject it. So there's a kind of pacing the way things go and the way we accept them. And so what does that look like? What is the roadmap? Policy tends to dictate how quickly we can put these things in place and use them at scale. And so I think at AWS, we're incredibly excited to see the CMS pledge for interoperability as well as prior auth to help us meet, we'll say, some of the previous policies that were put in place were great. They didn't quite meet the mark, and so we feel very confident that we'll start to see some of these things used at scale.
Yeah, and I'm biased, but I'm super excited about it. I look at the 7 billion searches a month for medical guidance in Google and how that experience could be improved. I look at the over 100 and something million people a month that go to WebMD, and it's still kind of a one-size-fits-all. And the ability to tap into all these smaller LLMs, open up all these new data doors to create personalization in any language with adaptive learning has such potential.
I think you guys know better than anybody else the opportunity to make it very personalized.
I appreciate that. Okay, Chad, so one of the things that I kind of stuck out at me of kind of hearing you talk, and I want to talk in a minute about your prior experience, but in the role that you're in today is lagging data. How does that impact your business of, not having real-time data, and do you see a path to solving that?
Right. Thank you. Yes. Not familiar with the idea that there's a 2-month lag in data, that we have batch loads, fixed width files, all of these challenges from 20-year-old legacy systems that we're having to deal with. But before we got started with the lag of the data, it was really the quality of the data that was the biggest challenge. That's really where we've spent most of our focus for the first 3 years of my tenure at DCH. So much so that the commissioner grabbed me and asked me a question, former commissioner. We have a new commissioner as of a couple months ago, but the former commissioner wanted to know, how much longer is data quality going to be a priority? And I explained to him that, sir, this is a lifestyle change for healthcare, right? This is always going to be something that we focus on through data governance and all of those components. And I think he understood it at that point. I mean, he was always gracious enough to give me the capacity to do what I needed to do, because it takes a long time to deliver in many of these ways. But fixing the quality was core. Now, we have made a lot of progress. We've taken our enterprise data warehouse and we have brought that internally. It was vendor hosted, but now it is state managed. And what we've been able to do, even with the batch processing, we've gone from a 2-month turnaround for processing claims or reporting on processed claims to day of. They batch them up on the Fridays. So we have gained about 2 months. Still got a lot to do with making our data portable, making sure that we can tie all of our systems together and use plug-and-play capabilities and set the foundational things that we need to do so that we can have real-time data, streaming data services into these platforms where we can really know exactly, and the member can know as well, exactly where they're at in their journey.
Yeah. And you spent 20 years in higher ed. When you look at education and the challenges of COVID and moving content around and systems around, are you hopeful as you come into healthcare?
Right. I mean, I think interoperability is key to me. We had learning tool interoperability, and that is something that we use to deliver content specifically during COVID. Now, we had it around prior, but COVID was huge. I mean, we ended up packing up our training center, the computers, and sent them out to students that didn't have devices. But the one thing that we excelled at was delivering content and proctoring services and being able to expose those individuals and ensure that they were continuing their education. So I have firsthand experience how interoperability is core and how it can deliver what we're looking to in the future state.
And how does FHIR connections and interoperability play if that acceleration happens? Is that one of the paths that you see that help make this happen?
That's, when I first started, when we first connected the learning management system with the student information system, it was, we were getting a lot of quotes for 9 months effort and X dollars from both vendors, not just one, the both. And finally, we were able to get the right people in the room, and they knew that these things were LTI compliant. And we were able to turn it around at that point in 2 weeks. So at no cost, basically. So we went from a 9 month turnaround and X million dollars to a few $1,000s in 2 weeks. So hugely impactful.
Yeah, that's great. That gives hope. So as we talk about kind of rural Georgia and the $50 billion health fund and how those dollars could be made available to the state and deployed in ways that creates a lot of alignment, it's not all technology, right? So like how does the state think about it? I know right now you're gathering information, trying to talk to different hospital systems and others about like how do we tackle the problem? Are there any models that are emerging to you that like are kind of like the low-hanging fruit, or things that maybe are a little bit more on the edge case, but could proved out could have massive impact? Or is it too early to tell? We're still in fact finding.
Yeah, I think it's more about fact-finding. When this was announced, what we wanted to do was be transparent. We wanted to give everybody a voice. So instead of putting together our own game plan, we've held town halls. We've had 3 in-person town halls and 1 virtual. We've got online submission forms where the public can provide their recommendations as to how we shape this grant when we submit it. So we really wanted to hear from others and that live this day in and day out in the rural communities, how that might better help them, how this money might better help them. I mean, a lot of the things that you're going to have just generators, core infrastructure things, but then there's the technology infrastructure as well. I do believe that we can probably, from my perspective, build on some of the initiatives that we've already gotten started. We are high trust certified. If you don't know what that is, it's Health and Human Services way of showing that you're security compliance. We are the only agency that I'm aware of that's gone through it. Part of the reason we wanted to do that was to show that we were protecting our data, and if we were going to hold our vendors accountable for that, then we felt like we should do it as well. And why that's important and relevant to the conversation is that we have started recently going out to rural providers, because when we became high trust certified, we realized we have a lot to share. We can go to these providers, we can go to these hospitals and healthcare facilities and help educate them on how to protect their environment to keep, hopefully, their doors open. So we started that initiative about 2 months ago. We've made a couple of visits, but I do see that as the groundwork for some of that rural outreach that will be going on when the bill comes. So I think we will just expand upon that program, and hopefully, whether it's EHRs or what have you, still yet to be determined. But there's obviously a lot of technology components that are on the table right now.
When we started this, you asked me what excites me. And it's like when I can feed off of the excitement of what Chad's doing, proactively engaging, bringing everybody in to hear them and deliver on it. That excites me, right? Like, how can I enable the work that he's doing, because I can feel the passion, and he's got the history of doing it over in the education space. And so, like, that's exciting me, is like, how do we enable the work that he's doing?
Yeah, and I think in you in particular, it's, how do we bring your analytics to the table, so that as we do this, we do it fully transparently. Right. So I feel like you've got a big opportunity to help do that. And then, I've got two, kind of last questions. And so this panel is about collaboration. And, when I hear, Dr. Oz talk about collaboration, one of the first things he did is he issued an RFI in May and said, just like the state's doing now, is like, we're open for business and we're open for ideas. And you should have seen all the different people. I think they got 1,600 responses, and it was from doctors, caregivers, entrepreneurs, tech companies, everybody putting in their ideas. And they quickly took all those ideas in, and by the end of June, they had brought it down to those 5 mandates that I talked about, and now they plan on, launching these initiatives before the end of the year. I think, I know from working with all these guys on the stage here is they have a similar mindset of around collaboration, and I think that is going to be the big breakthrough in healthcare. Like, I've been doing this for a long time. I started WebMD in 1998. That was a long time ago. And the difference between then and now is I'm not feeling the same, everybody's working in their own silos as I have in the past, and it's kind of everybody protecting their data and everybody protecting their ideas. I feel this real sense of momentum. And what we talked to Dr. Oz about and others is how do we go from a pledge to a push? And when we make that push, how do we do it in the state of Georgia? And to make a model for elsewhere. But I think it might be worth a minute just to take each one of you guys just to talk about, how does CLEAR think about collaboration?
Yeah, I think it's important for all of us to recognize that this concept of interoperability, it will take a village, and it will take collaboration across patients and technology companies and plans and providers. And what we've been really focused on is educating the market and also working directly with partners that are doing this today and making sure everyone understands what role each party plays. And so, for example, with CLEAR, the reason that we are so excited to be working alongside CMS and organizations like Sharecare and AWS is we provide certain tools to actually empower patients to bring in their own data and generate better health outcomes. And one of those tools is that we provide identity verification at IAL2. It's an acronym, it's a NIST certification, but it is the CMS standard for identity. And essentially it means that we are rigorously verifying each individual to make sure that that is indeed Alex that is accessing their data. And at the same time, when someone is verified by CLEAR, we generate a token, and that token goes to our partners in that ecosystem. And that is fundamental to how they match that patient to other data sources. And so without that piece of identity, you get mismatched records, you get errors, you get patients not being able to pull in their data or the correct data. And so we take those roles very seriously, but we recognize that our partners are doing a lot of incredible work in terms of how they manage consent with the patients, how they facilitate that matching, how they curate and make the data usable. And so I think what's been exciting over the past 6 months or so is all of these amazing organizations coming to the table, recognizing how they can help this become a reality and where we need to partner to actually, again, bring that data into the hands of patients.
Where that solves like real problems for somebody like us is, we have 800 people that collected 7 million medical records last year. It's a lot of work, to collect 7 million medical records, a lot because of the identity management. I got to make absolutely sure that I'm delivering the right medical record to the right person. And so these types of innovations, really speed that up and ensure quality data. So it's amazing. So Chad, what about on your side with the state?
Well, for collaboration, I mean, I need these types of entities, right? Like, I have to have them. I can't do this work myself. It's impossible. We spoke earlier. I was the data center for 19 institutions, and I couldn't get one server built the same way twice, right? Like, never, ever. I go over to your environment, and I'm pushing buttons, right? Now it's about metadata tagging. That's really what I've got to focus on to make sure that standard is there. I don't worry about the servers. I don't worry about production down and rooms clearing out and people running away because they have to go solve a problem. We get to focus on some more important things. But I do think it's about needing each other. For me, though, my goal is it's more about the people than the technology. I know the technology is fantastic. It's doing wonderful things, but we want to focus on user experience. We want to make sure that we streamline our applications. We make it easier to get in and process those applications and get out. So we use a lot of human-centered design to do that, to make sure. And it's funny when they say human-centered design, I think it was always a human designed it or designed for a human. It was just designed by a developer, which I'm a former developer, so I was part of the problem. But now we're taking and making sure that we're using the user and focusing on that user to do that. But the biggest thing, I think, is if I can say that I eliminated the tech debt and I was able to put us in a position where we were plug and play and new capabilities came out like clear identity proofing and those types of things, that we can just pop that in without all the other work to go along with that, I will have been successful.
Yeah, I agree. What about you, Matt?
I'll give two answers here. First, when it comes to collaboration, transformation rarely, if ever, happens in a silo, right? When you really think about it. And so if we're going to transform healthcare, it's not going to be one cloud provider. It's not going to be one identity. It's going to be a group. It's going to be everybody collectively getting together, sharing the data towards that common cause, right, to improve healthcare and the patient outcomes and patient experience, et cetera, on down the road. But how do we enable that from a technology side? So first, just friendly reminder, because you talked a little bit about interoperability. So population health is actually stage 4 of interoperability, right? And which means that your data is truly ready to go to drive a lot of the analytics and, of course, the interventions. And so when I think from a data standpoint first, the time frame around getting your data interoperable with agents is going to shorten significantly to what it was previously, because I'm not mandated. My data doesn't necessarily all have to be in FHIR because I've got agents that can translate it in between. But beyond that, when we think about the analytics and the simplicity around the analytics, whether it's predictive analytics, prescriptive analytics as well, those are great. But a lot of us in our jobs, we all have dashboards. Dashboards are great because they tell us what we're supposed to do for the day. But we see a lot of this repetitiveness in these dashboards and they're kind of a pain. And so the next phase is really about interventions and automating those interventions, because if we've done the same procedure, 30 out of the last 30 years, odds are that 31st year it's going to be the same. And so when we think about all of these visual dashboards and they look all great, I think the preference here is, what if we just automated the engagement directly to our patients or our clinical teams or our care management teams so that they're aware we don't become the intermediary of this and we just accelerate the timelines? Because I think at the end of the day, everybody wants to deliver great care and have the right information at their hands and disposal. And so, short answer is we're working towards that. Technology is definitely there, especially after what you've seen over the last 3 years, and just lowering the bar of expertise needed to do this at scale.
All right, so it sounds like that's what success looks like to you.
Absolutely. Absolutely.
And what about you, Alex? What's success look like here for Georgia?
I think success for Georgia looks like all Georgians having a IAL2 digital identity credential that they can use across their ecosystem of their provider and their health plan and their employer benefits. And with that, hopefully less paperwork, kill the clipboard, and better access and more personalized care because they're able to really pull in their data when it matters.
And I can go to the Braves game.
Yes. Yes.
Yeah, right. And then Chad?
Centralized, secure data. I mean, that's really core to everything that we're doing right now. Cleaning it up, making sure that it's interoperable. That really is. I mean, I think it's truly important. I've seen the light on the other side and trying to bring it to this space.
Yeah. And in closing, thank you for that, is, in closing for this, I think what I'm trying to articulate to you guys is, you're here at Health Connect South because Russ has built a culture here for the last 12 years of collaboration. And this is just such a perfect storm for all of us to think really big and to do something huge. We have the technology breakthrough that I've never had in my career that is absolutely game-changing. We have the policy breakthrough with a sense of urgency and funding in which they're trying to make things happen. And this is just a small, tiny example of what committed collaboration looks like. But I think we're all open for business, and I'm sure you are too. And we need to figure out ways that we can all work together to leverage your subject matter expertise to plug into a platform and an ecosystem that can improve the well-being for all Georgians. And I think these guys did an awesome job today showing you how they're doing their part to make that happen. And I hope that encourages everybody here to join us in that mission. And hopefully this won't be a 2030 vision, but this could be a 2026 reality. So thank you to the panelists. Really appreciate it. Thank you guys for all listening. Take care.